INPAT is an international network of pediatric elderly teams. That means that we create like a family, because the atmosphere is really friendly between all the meeting dealing with difficult airway surgery, difficult airway cases, and we try to do the best to sharing knowledge and skills and to help the health care of these difficult patients for their families.
You started INPAT?
Yes, because the first INPAT was in Genoa in 2017, second in Rome, and now it's going around the world, and it's a growing group.
You are an amazing surgeon. So what kind of conditions do you treat?
There are a lot of congenital conditions for example, stenosis of the airway, tracheal stenosis, laryngeal stenosis, cleft, and fistula, or some acquired stenosis, babies intubated or operated for cardiac surgery or other things who develop stenosis. So basically, people who need reconstruction or resections, or people with malacia who needs to fix the tracheal wall to have better breathing.
So do you think any surgeons can do this, or need to be specially trained surgeons?
Especially, I think the most important thing is the team. A surgeon alone is not going very far, and only with a team we can help really the children.
Yes. So what kind of symptoms will the children have that need to be treated?
Stridor and cough, recurring cough, respiratory infections, sometimes also feeding problems, and sometimes they get they cannot breathe very well. Sometimes it's not so important. Sometimes it's very severe condition. There is a wide spectrum of symptoms.
So, do you think that if the local team doesn't get good results in improving, they should contact you, particularly if they're in Italy or the surrounding areas?
I think that every country maybe could develop a network and a few centers to centralize the cases in order to have a better experience, because they are rare conditions. So if you have one or two cases in 1 year, you cannot give the best treatment maybe. So it's better to centralize, I think.
So how can people who have a condition contact you if they need it?
My email, my phone are on internet, so it's quite easy for the families to find Gaslini and Gaslini Institute and myself also. And I'm trying also to get contact with the pediatrician and the other hospital.
Yes. I think you're making a small impact on a large problem. You need much more impact. So many patients go untreated or treated not optimally.
Yes, of course. And always the best chance to help the is the first operation.
Yes.
That's important.
So many of us work so hard that we don't get to see our families very much. It's true, we spend so much time on our patients.
Yes.
So this is his wife who said, say something.
It's difficult.
How hard does he work?
How hard?
Yes.
It's full time. It's a work of full time. It's a dedication, a life dedication. It's something of...
It's a life work, a life commitment.
Yes, of course.
But
no,
because when you are at home, you going on thinking to the patient.
Yeah, it's not a work of only a few hours.
You're never really free.
Your life dedicated to improve, the life.
Yes.